Hello, everyone, and welcome to KSI's second interview on the hidden epidemic, the mental health of secondary school students. My name is Joey, and I'll be your host for today. I'm one of the youth leads here at KSI, which is an independent think tank based in Kuala Lumpur. Once again, we're going to be assessing the effects of Malaysia's public education system on the mental health of secondary school students. This time, we'll be hearing from the perspective of Professor Dato Dr. Andrew Mohanraj. It is my pleasure to introduce and welcome Dr. Andrew to today's interview. He is a consultant psychiatrist who has served in the Ministry of Health for 12 years. His consultancy work extends to government and non government agencies, both locally and abroad. And this includes his position as the president of the Malaysian Mental Health Association. And beginning this year, he has also taken up the position of a mental health and substance abuse consultant for the World Health Organization Regional Office. It's such an honor to have you here with us today, Dr. Andrew. How are you doing?
I'm doing well. Thank you. Thank you so much for that very generous introduction, Joey.
Yeah, of course. And it's so good to hear that you're doing well. And we really appreciate you speaking with us today. I'm really looking forward to hearing your thoughts in this
Yeah,
area of mental health. So let's jump straight into the first question.
sure.
Malaysia has been experiencing a decline of mental health even before the pandemic, especially among children and teenagers. So, to start us off,
Yeah.
Doctor, could you tell us about some of the main mental health issues
Yeah.
that Malaysia's secondary students struggle with today?
Thank you for that question, Joey, because there's been, I think, recently, and when I say recent, I'm saying the last decade or so, there's been a great deal of interest with regards to the psychological distress faced by school students. And we have done a couple of surveys. The ministry has done it, independent bodies have done it, and generally all these findings point to the fact that depression, anxiety, and stress seems to be the major mental health issues faced by students in the secondary schools. But those are the main clinical entities, I would say. But along with that, you also have a lot of negative attitudes or negative mental health attitudes, which also leads to poor help-seeking behavior, and there also seems to be a lower levels of resilience among secondary school students, and we'll discuss this later in the interview. But and there's that, and I think it's very peculiar to the Asian culture. Seems to be also, in my opinion, a low level of self-compassion, less forgiving to oneself, and this is also probably caused. The main driver behind this is the high expectations of parents on their children, particularly those in the secondary schools.
What an insightful way to start off this interview. Thank you, Dr. Andrew. And I think it's so interesting to hear about, the other aspects of mental health that we might not consider apart from the clinical sides, like you said,
Absolutely.
depression, anxiety. But yeah, I thought it was really interesting your point on the lack of self-compassion and that culture we have, in Asia or Malaysia, And following on from that, let's talk about the link between Malaysia's national education system and the mental health of secondary school students. So, in your view, how has the structure and conduct of public schools in Malaysia affected the mental health of its students?
Well, this coming back to that first point that I made earlier on your earlier question, the fact is that I think our school system, particularly the secondary school system, is so performance driven, and this is actually seen more in secondary vernacular schools, really, and that's the main infrastructure, or rather the flavor of our education system, you see, and we need to have a relook on that, and also the role of teachers also sometimes is not given enough attention, in the sense that we look at the students' mental health, but the fact that teachers themselves are having a tremendous burden, because it's a great expectations on teachers itself. So that is also can be related to the psychological state of students. and also reflects on the structure and content of our public school system in Malaysia. Then, of course, you have this peer pressure, and given the fact that in the last 10 years, there's a bigger role that social media plays on the lives of every one of us, including students, and I suppose particularly secondary school students, because they are in that formative age where they are trying to, look for an identity for themselves and learning to interact with people, sometimes in some stages also discovering some form of intimacy and things like that. So therefore, in this particular phase that they're going through, social media plays a very important role in their lives. And along with that, when you're looking at it from a perspective of being a student, it also results in a lot of cyberbullying. So that is another factor that seems to be intrinsic to our secondary school system in Malaysia. I know this is a universal phenomena, but I think it's also playing a role, a very significant role in Malaysia. I do, as a psychiatrist, see many cases, many students who come to see me, and I can tell you that many of their psychological distress is as a result of cyberbullying itself. You see, and the whole system does not encourage any help-seeking attitudes. I think the school system is so performance-driven; it has very little time to encourage students to seek help. And of course, both students, teachers, as well as parents also generally, I think in terms of mental health literacy, there seems to be that is an area that is wanting. And with improved mental health literacy, and hopefully the whole education system should encourage that, then we will find people seeking help and understanding the need to mainstream mental health issues. And finally, what causes all this? To me, in my mind, the one factor which is just staring at our faces here is the issue of stigma. The Asian culture stigmatizes mental health issues, and those who are struggling with issues of mental health itself. So this is a major challenge for us. And if we can somehow overcome this or handle this better, then I suppose it will result in mainstreaming mental health issues, recognizing that mental health issues is a problem, is an issue that we must tackle, and at the same time assist in help-seeking behavior.
Wow, there's so much to unpack there, Dr. Andrew. And I think it's so important to know what you said about, secondary school being such a formative time of,
Absolutely.
an individual's age. Yeah. And to even recognize the different factors that affect their mental
Yeah.
health performance, and role of teachers, peer pressure, and of course social media, such a big part, of a teenager's life nowadays. And in relation to what you just mentioned about schools being performance driven, Malaysia does seem to have fostered a culture of needing to strive
Yeah.
for academic perfection. And while there's been some discourse on how this emphasis on academics can affect mental health, Doctor, could you today tell us, in turn, how mental health issues actually affect the performance of secondary school students instead?
Yeah, yeah, thank you. And that's, you know, the sometimes it's a bit of a chicken and egg situation here, but the fact is that obviously, naturally, it's going to work to have a tremendous effect on performance of the students, resulting in poor performance, and also not just poor performance, but also result in burnout in students. And I have seen many of my clients. Secondary school students who simply give up and suffer a burnout as a result of this tremendous pressure on them, and then eventually resulting in poor performance and sometimes even dropping out of schools. And again, coming back to my earlier point of the expectations of parents, because the parents have so much of expectation, and they are stressed out themselves. This stress somehow vicariously is imposed on the students. So while the student himself or herself might not be overtly concerned about performing well in subjects that they are not particularly interested in, but because of the stress faced by the parents, that stress is imposed then by proxy, so to speak, on the students themselves. So they too feel stressed out. because of the parents' expectations. Now, I have also seen difficulty among students in coping with all this psychological distress as a result of their expectations of their parents, of society, and their own difficulties in coping with the burden of the education system, resorting to substance abuse, for example. So you do see increasingly among secondary school students resorting to alcohol or stimulants or any other form of drugs in order to cope with their difficulties. And what is also not usually spoken about is this sort of psychological stress can also have a burden on the physical health of secondary school students. And again, we have seen many students actually presenting with what we call psychosomatic symptoms, for physical symptoms, but which has a basis. The basis of this is their psychological distress as well. And we also find students who are very clear about their psychological distress, but because of neglect and their difficulties in coping, it also results in physical, what do you call that, manifestations as well. Uh, so that I would say would be the mental health issues that really affect students, the performance of students.
Thank you for those insights, Dr. Andrew. And I think the key takeaway that I got from that was expectations. Be it from themselves or their parents, and learning to cope with those expectations isn't something that is necessarily lent to these students. And I especially liked your point about burnout, because oftentimes personally when I hear about burnout, it's to do with adults and people in the workplace, and you
Yeah,
don't necessarily recognize burnout among students, and the tremendous pressure, like you said,
yeah,
that they actually carry.
yeah, yeah,
And
yeah.
we've talked about mental health literacy just a little bit, and we've touched upon it just now. And I was hoping to actually explore that a little further today, Doctor.
Yeah.
So I was wondering if you could tell us a little bit more about the state of mental health literacy and help-seeking attitudes among Malaysian youth, and in particular, those in public secondary schools.
Yeah, Joey, I'm glad you asked this question because this is something that we have been, talking about the last 5 or 6 years in various platforms and forums. And although on paper we have in the public schools, really, we have two counselors per school. So there are 10,000 schools in the country. So you're talking about 20,000 school counselors. And this excludes counselors in the higher learning institutions, right? And so, but when you look at the number of cases that the counselors see, they are very, dismal, really. There is clearly a poor uptake on the services of the school counselors. And this is actually quite puzzling, given the fact that there's a lot of mental health issues. We know that for sure. We have done a couple of studies, and it clearly demonstrates that secondary school students face, anxiety, stress, and depression, as we have discussed just now. So why is it that there is a poor uptake of the services of the counselors in school? So, I mean, there are several factors to this, and one I think clearly is the fact that there is poor mental health literacy, in the school scenario, as well as parents. And to some extent, I would also say that probably the school counselors themselves are not fully, and we must be frank here in our discussion. I mean, as much as I would like to, I mean, I do appreciate that the counselors do have their challenges and they're doing a great job, but it must be admitted here that the school counselors are not fully equipped to be able to to reach out, to be able to detect cases of depression and anxiety in students. And worst part is also, even if they were to detect these cases and reach out to students, then what? The whole referral system beyond that is also not very clearly defined. And so ultimately, yes, you're right. When it comes to literacy, there is poor literacy here that is contributing to poor uptake of services. At the same time, the services itself is not entirely fine-tuned to meet the demands of the students.
Thank you for your transparency, Dr. Andrew, of regarding this issue. And I think it is important that we address the reality of the help that these students are getting. Like you said, on paper might seem that
Yeah,
it's going great, but
yeah,
like you said, there's
mm,
poor uptake of
mm,
students.
mm,
Referral system is not clear, so
yeah,
clearly something needs to be done about this.
yeah,
And
yeah,
Doctor, you in the 12 years that you served in the Ministry of Health, you spent two of those terms as a member of the Mental Health
yeah.
Promotion Advisory Council. Could you talk to us about how successful these mental health literacy campaigns have been, such as the 2019 Let's Talk Mindasihat campaign in combating mental health issues among the youth?
Yeah. Thank you, Joy. And yeah, it's true that I served two terms in the Mental Health Promotion Council. And I think it was, if I'm not mistaken, it was during my second term that this issue of psychological distress faced by secondary students became a bit more alarming for us, particularly after a survey showed that in the schools in Sabah, it was very significant to find secondary students there. The numbers of students there with serious mental health problems were a bit shocking to us then in the council. And that's when it was decided to start these campaigns and think of ways in which secondary school students particularly can be helped. What was concerning then also was the rates of suicide among youth, and that too involving secondary school students. But as far as the how does, I mean, MOH has started these campaigns, the two campaigns that you mentioned just now, and I must say it was done very vigorously, involving all stakeholders here. So there is, in terms of numbers, there is a lot of participation by the stakeholders, the parents, teachers, and students in this. The Department of Education in each of the states in Malaysia have also been very encouraging with this initiatives by the Ministry of Health. So there is a lot of collaborative work going on there. But again, my point comes back to the placement of the school counselors. Although we do have 20,000 counselors in schools, I think the immediate action that the Ministry of Health and the Ministry of Education should do is to increase the capacity of these counselors to tackle problems. One way of doing this is to give them, they're already counselors, they're already placed in schools, so you don't have to recreate something new and create a position of counselors to be placed in school. All you have to do is increase the capacity of these counselors here. One way to increase that capacity is to give them some sort of training in mental health first aid, for example. Now, the Malaysian Mental Health Association actually does this, and we have been engaged in many schools across the country, many other stakeholders as well. And what we do is we promote a course called the Mental Health First Aid, MHFA, that would equip school counselors to not only be able to do early detection for psychological stress among primary school students, which can be far more challenging, of course, and which is far more clear cut as far as secondary school students are concerned. But after that detection, how do you engage with the students? How do you encourage a help seeking behavior? At the same time, be tackling issues of stigma and reluctance to seek help there. And subsequently, the recognition that there could be cases that cannot be solved by mere counseling. For example, if somebody is severely depressed and is suicidal, obviously that is beyond the scope of the school counselor. So what does the school counselor do then? How do you get families involved in the whole therapeutic intervention? Where do you refer these cases to? These are things that has to be fine-tuned, and I believe that the Ministry of Health as well as the Ministry of Education must sit down and fine-tune these processes and get this whole infrastructure complete. But then again, I don't want to be pessimistic here. The fact that I'm repeatedly pointing out that we have 20,000 counselors all over Malaysia in all these schools, I mean, that is something admirable, right? I mean, this is a fabulous resources that we have, and all we have to do is tweak things a little bit, give additional training to these counselors, and I believe strongly that we will be able to, tackle these issues, or address this decline in psychological state of our students.
Yeah, like you said, I think it's so important to recognize the progress that we're making.
Yeah.
20,000 counselors,
Mm,
participation by stakeholders, all of that is so encouraging. But,
absolutely. Mm,
yeah, and as always, with the things that matter, there's room for improvement.
yes.
Talking about what you said, immediate action of increasing the capacity of
Mm,
counselors, introducing things like mental health first aid training, and fine-tuning the processes, and Ministry of Health and Ministry of Education needing to sit down and really have that conversation.
yeah.
That's so important. And thank you for bringing that
Yeah,
up,
yeah, and
Dr. Andrew.
yeah, and maybe one other thing, Joey, that maybe I didn't emphasize enough is the role of parents. There is a tendency in Malaysia, and probably it's actually the whole Asian culture, really, where parents take a step back and say this whole education process is the job of the teachers and schools, and leave it at that. But that's wrong, really, at least when it comes to looking at mental health issues. And I strongly believe we must work out a system which clearly puts in place the role of role of parents as an active stakeholder here. That's really important. And we must come up with things. I mean, we do have parents, teachers associations and things like that. But looking at mental well being, really moving forward, parents are an important stakeholders here. Of course, they have their own things to do, work to do, and bring home money and stuff like that. But education is something more than just, passing exams and getting a degree or whatever. And this whole process, this whole experience must include parents as an active stakeholder.
Completely agree with you, Doctor. The fact that students are really only interacting with two main bodies: their parents, their families, and the people in school. And the fact that we haven't worked out a good enough system for parents to be more aware of these
Yeah,
mental health issues
yeah,
among students is an issue. And
yeah.
sort of to ride off what you were saying, talking about fine tuning the processes. Do you think there are any other actions or initiatives that the Ministry of Education or Health
Mm,
can take to address this decline of
mm.
mental health?
Again, coming back to this whole concept of mental health, I mean, this discussion probably has a tendency to become a little bit philosophical along the way. So you must forgive me for that. But, when you look at the whole concept of education, it can be very esoteric in some ways. Like, really, I think we need to ask ourselves, what do we expect to get out of this current education system? And what is education finally? Is it not about getting knowledge, enough knowledge, the appropriate knowledge for you to function as a good citizen, as a good human being, to have fulfillment in life? Or is it something more than that? And or I wouldn't say not more than that, but it's completely something else, where you just chase after a paper qualification, and then think that you must earn as much money as possible once you've got this qualification. So I think there has to be a rethink for that. But while we are doing this thinking, and this thinking can go on for 10, 20 years, we never know how long it takes, and it's very subjective. What we can do in the meanwhile is that to encourage students, for the whole education system to open up, to make students and parents understand that students need not choose very conventional or traditional careers in life. And there are careers in life that can be more suited to the students' needs and students' wishes. That itself is going to bring down the psychological stress among students, because secondary students, I tell you, in our country, are probably very subjected to what the wishes of parents are. If the parents, for example, want to, I can tell you from my personal experience. And fortunately, I didn't have too much of distress, with that. But in my family, it was decided, like, who becomes a doctor, who becomes an engineer, who becomes a lawyer. That is all predestined, like when we were in primary school. Fortunately, none of us, it was not incongruent to our thinking. But if I had wanted to become something else in my life, and I was forced to become a doctor, I would be in great distress, really. The education system should be able to tell parents, teachers as well, and students that, listen, You can do whatever you want out there as long as it brings you fulfillment. It can also put food on your table, and don't worry about conforming to needs or expectations. This is the first step that we should take, beyond getting more philosophical as to discuss as to what the true meaning of education is. I think this is possible. It can be done in many setups. It's already being done. You can see that happening in international schools where parents, teachers, and students as equal stakeholders are actually discussing this whole concept of education and what they need to do when it comes to choosing a career. Then coming back to the other point of capacity building of teachers and counselors, I think that is something that needs to be done now. Almost immediately we can do that. Increase the capacity of existing teachers and counselors for them to be able to reach out and detect psychological distress among students. But also, Joey, what we had discussed earlier, something else that can be done almost immediately is to establish a clear pathway as to what happens to students who are depressed or who are suicidal, who have high levels of anxiety. When these students you reach out to them and you establish some sort of a therapeutic relationship with them, what happens after that? And I can tell you, in many cases, it stops right there. And sadly, there have been documented cases of suicide among secondary school students when they have already been detected, they've already been engaging with the school counselors. So that therapy, so-called, whatever you call it, like a therapeutic relationship was already established. And beyond that, they attempted, and many actually committed suicide also, because subsequent to that therapeutic relationship, the cases were not referred. The whole mechanism was not did not accommodate this whole referral system in that. So that is something that needs to be done in order to improve mental health of students.
Yeah, wow, those are really, really incredible insights. Thank you, Doctor. And I think it's important that we're asking ourselves these philosophical
Yeah.
questions because they're the ones that shape the systems that we're in. With the whole
Absolutely.
idea of
Yeah.
culture and parents expecting their children to conform to certain streams, science streams, and
Yeah.
things like that. And
Absolutely.
and what you said about like
Yeah.
increasing the capacity of teachers,
Yeah. Yeah.
and you're
Yeah.
making sure that cycle of mental aid actually
Yeah.
closes,
Yeah.
and and getting the help like
Yeah.
to students that they need, and not just helping them initially, but
Absolutely.
really going all the way with it.
Yeah.
Yeah,
I'm,
definitely.
Joey, it's very interesting that you mentioned stream just now. I didn't hear of this word for a long time, and clearly, you and I are different generations, right? So, but I remember when I was in secondary school, this question of going to art stream or science stream was something that the parents were more concerned about than anything else, and that's because they had to tell the neighbors, like, what happens, like, is your son in the science stream or art stream? And the ones in art stream used to put their head down and say, "Oh, my son is only, he had no choice. He didn't make the grade, so he couldn't go to science," as if it was a big shame. But it's interesting that you brought up that issue of stream, because clearly after all these years, it still matters.
Yeah, definitely. I remember, so I went to an international school and I had to choose my IGCSEs, and my
Uh,
parents were like, "You're going into a science stream, like only afterwards, if you want to branch up into the art stream, you can." But like you said, this is a culture that has
yeah,
persisted,
yeah,
and it is concerning. And beforehand, you mentioned something about mainstreaming mental health in schools, and I was wondering if you could build a bit upon that.
yeah,
What do you envision in terms of
yeah,
mainstreaming mental health? Do
yeah,
you think
yeah,
of education, or more campaigns?
yeah,
Maybe
yeah.
some of your thoughts, Doctor?
Yes. No, I think you should just, for me, mainstreaming means uh, normalizing the conversation on mental health. So that should be the environment in schools, in all higher, educational environments, where there is a normalization to understand that, yes, I do feel stressed out about, certain things. There could be some underlying reasons for this, and sometimes a recognition that it could even manifest into a major mental health issue like depression, feeling insecure and feeling suicidal even. But that does not mean that you cannot seek help and then get back on your feet as soon as that help is sought and you get things sorted out and get appropriate intervention. And all intervention need not be just by seeing a psychiatrist or being on medication. Counseling and psychological intervention also can help. So this kind of conversation on normalizing it must be standard in our educational system. But for that to happen, obviously, just as you mentioned just now, there must be enough campaigns to drive this. And also probably students being at a period of time where they're trying to create their own identity as well. So it is also a period of time when they look up on individuals in societies, whether they are sports people or whoever else, celebrities or some other people whom they might admire, and to discover that these people also struggled with their own mental health issues and have done pretty well for themselves in life. Many of the great inventors that we know today actually struggled with their own mental health issues. So, and they have overcome it. The trick is to understand, to identify it, and then do something about it. So if the school environment can encourage that somehow, I mean, we will continuously face this obstacle of stigma. That's cultural, that's in our DNA. But that doesn't mean that we cannot fight it and try to normalize things. That is my vision of a system, an educational system. This has to be matched with the ability of the system to respond to those who are in distress and who are seeking help. And if this can be matched, then I think we will have a fantastic education system and environment that allows people with mental distress also to thrive in it and be, productive human beings who can achieve a lot and be fine, responsible citizens of this country.
Yeah, absolutely. You know what you said, normalization of
Mm,
talk about mental health and making sure that it matches the ability of these schools. I think that is an
mm,
incredible suggestion. And we're nearing the end of this interview
mm,
now, which has been so quick and such an enriching discussion as well. So as a penultimate question, Doctor,
yeah.
from a psychiatrist's perspective, what are some changes in Malaysia's education system specifically
Mm,
that you think would improve the mental health of secondary school students?
Okay, thank you. Now, you mentioned from the perspective of a psychiatrist, and what I'm going to say is probably not very clinical because a psychiatrist is a very, it's a clinical profession. But my suggestion is, having seen all sides and given the fact that I've done a lot of development work and systems development really in mental health as opposed to psychiatry. Now, I feel mental health needs to be really taken out from the ambit of health. It should not be seen purely as a health issue. It has something, it's something bigger than that. And as far as students are concerned, of course, we got to look at the underlying system and the issues of the burden of this whole education system, whether or not, I mean, where is this? What is the purpose of making students, study a whole lot of subjects that might not be relevant to them? So that has to be a new look into what this whole education is about. And is this, how tailored is this to meet the demands of our society? So there has to be a match into this. So that causes a lot of mental health distress, and that is something that has to be looked at as well. Then, of course, there's social and economic issues and ideological issues sometimes also refer affecting our students and youth today. So it has to be taken out. Our policymakers must look at mental health amongst school students beyond just a clinical issue, and to say, okay, if you fulfill the criteria for depression, anxiety, this is the intervention that we're going to do. You see a school counselor, a psychologist, or maybe see a psychiatrist, get medication, and it's over. But that's a bit of a knee-jerk reaction. You're going to look at it holistically. You've got to look at other aspects as well. And in this, in the light of what I'm saying now, surely we should expect also NGOs. So, we have research bodies, we have, your organization as well, government or agencies. We should all be involved in this whole process of mainstreaming mental health, and not just looking at it from on what the government can do, or whether it is purely clinical. So we should bring all these agencies together, and I think that is where we are also lacking in this country compared to many other places in the world, where they do have some form of leadership, mental health leadership. I mean, if you look at countries like Australia, you have like almost in about 3 or 4 states, I think in Northern Territories, Queensland and Victoria, as well as Western Australia, they do have ministers for mental health. That is, as different from ministers for health. They've taken, like, there's a separate portfolio called ministers of mental health. So is the case in the UK as well. There's in England, there's a shadow minister for mental health. Imagine that, you see. And many other countries, they have commissioners for mental health, and some sort of ombudsman body to look into mental health as a whole. So I think some form of leadership in this country can bring together, galvanize all the stakeholders, parents, community leaders, religious leaders, NGOs, research bodies, think tanks like yours, to come together to position ourselves where we can say, this is the time to rebrand mental health, not so much as a clinical issue, but as mental well-being. And that is what that is really needed. And one example of this, is the 20,000. I keep coming back to the 20,000 counselors. We have 20,000 counselors in schools. We have 1,500 social workers and counselors in the Ministry for Ministry of Community Development. We have 1,500 of them. This is excluding the ones in the Ministry of Health and the universities. Why can't we get every one of them together? Together meaning, giving some sort of additional scaling up or additional capacity building, deploy them in the communities and interact with community leaders as well. And all this will contribute towards youth mental health. And particularly, to me, in my mind, in this difficult period that we are going through as a country, this is the time to focus on the resilience of youth today, which includes secondary school students as well, and how to help them cope with this pandemic, and how to bring them out of this, and yet not be dismissive or cynical about our whole system in our country. How to instill a sense of belonging to them in them. So I'm looking at it, mental health is more than just psychological distress, as in the form of anxiety, stress, or depression, or suicidality, but I'm looking at something bigger than that. So we need that sort of leadership to galvanize our society together. And this pandemic has, in one hand, made things worse, because we are going to see the youth paying a price for this, particularly the rural youth and the urban poor. But on the other hand, it has also resulted in a conversation about mental health. You and I are having this conversation today about mental health, youth mental health. And probably that's also in some way been as a result of what we are seeing, that's been caused by the pandemic. So this is how I look at it. Ultimately, we need leadership in mental health.
Definitely. And what you said about, rebranding mental health as well, and how it shouldn't purely be seen as a health issue, while recognizing that, this is something that requires leadership. You giving the example of Australia and the UK and them having like
Yeah.
ministers for mental health is so, such a step forward in
Absolutely.
terms of, bettering mental health conversations. And I just have one final question for you,
Sure.
Doctor, to wrap this conversation up, and that is, what are three key takeaways that
Ah,
you would give to our audience, or policymakers or youths, in terms of, how do we as a community better the mental health of adolescents in this country?
yeah. So three takeaway messages now. Well, one thing is for sure, one is immediately is to focus on school mental health, and in particular secondary school mental health. I think that is essential. When I say essential, I mean it's also quite structured now. We have the counselors. All we need to do is increase the capacity of the counselors, work out a pathway in which cases can be detected early, and then follow up as well as referral. So that pathway needs to be looked into, and that is my number one takeaway message, that we have to focus on that clear pathway, using the existing resources, rather than inventing something new. Number two is for us to look at the whole, beyond just education, but youth mental health, which includes young adults as well, and to see how we can, galvanize society stakeholders to come together in order to ensure that the talent among the youth is not wasted, and how we can preserve their mental well-being, instill resilience in them, and a sense of belonging and love for the country, because this is the group of people who are eventually going to be our leaders, and the future of our country depends on them. Therefore, my second take-home message is to focus on resilience among the youth. That's right. And the third take-home message is, hopefully with this discussion, somewhere somebody listening to this, watching this, will understand that ultimately, and the time is right now for mental health leadership in this country. In whichever form, there has to be a sort of a leadership to bring about all the stakeholders together, and to recognize that mental health issues must be tackled immediately, and to normalize a conversation on mental health. So those are my three take-home messages.
Thank you, Dr. Andrew. I think highlighting those three takeaways, focusing on a clear path, on using existing resources, focusing on resilience among youth and mental health leadership, such a great way to wrap up this conversation. And before we end this interview, Dr. Andrew, what is the best way that our viewers can contact you or,
Oh,
the Malaysian Mental Health Association for, greater discussions on mental health?
yes, please do contact us. I think our email, I mean, you could reach us at admin@mmha.org.my. You can get into our website. There are numbers there as well, but feel free to reach out to us. And when I say reach out, I just don't mean that, not only to reach out to us for help, which we will readily be, when, if it is possible to assist you, we will do that, but also reach out to us with ideas, partners, on how we can together improve the mental health landscape in our country.
Hmm. Yeah, thank you, Doctor. And we will definitely be sharing those contact details alongside this interview. And additionally, if you'd like to know more about KSI or our initiatives surrounding mental health, please do check us out on our social media platforms, or you can hop onto our website, and that's www.kasi.asia. Thank you again, Dr. Andrew, for being here with us and for such an insightful conversation, and thank you as well for the work that you do for in improving mental health and like here in Malaysia and across the globe. And it's been such an honor to be able to hear from you today.
Thank you. Thank you for inviting me. Thank you for this, this opportunity to say what I wanted to say. So lovely.
Mm.
And hope we have another occasion soon to
Yeah, that
exchange ideas. Yes.
yeah, that'd be amazing. And thank you, and thank you so much as well to our viewers for joining us today in our interview. And yeah, have a great day ahead.